When considering biological DMARDs, BDMARDs for managing rheumatic diseases, several precautions are crucial to ensure patient safety and optimize treatment outcomes. One for infections, tuberculosis TB. Always screen for latent TB before initiating BDMARDs, particularly TNF inhibitors, as these can reactivate latent TB. A chest X-ray and TB skin test or interferon gamma release assay (IGRA) are typically used. Hepatitis B and C. Screen for hepatitis B and C viruses, especially in populations at risk. Reactivation of hepatitis B can be life-threatening, so consider prophylactic antiviral therapy if necessary. HIV. Screening for HIV may also be appropriate depending on risk factors. 2. Vaccination. Live vaccines. Avoid live vaccines during BDMARD therapy due to the risk of infection. Ideally, administer any needed live vaccines, e.g. MMR, varicella, at least 4 weeks prior to starting treatment. Inactivated vaccines. Patients should be up to date on inactivated vaccines such as influenza, pneumococcus, and COVID-19 vaccines before starting BDMARDs. Harbor 3. Risk of malignancy. While the risk is generally low, there is some concern about the potential increase in certain malignancies, particularly lymphoma and non-melanoma skin cancer with long-term BDMARD use. Regular skin examinations and age-appropriate cancer screenings are recommended. 4. Heart failure. Caution is warranted in patients with moderate to severe heart failure, particularly with TNF inhibitors, as they may exacerbate heart failure. 5. Monitoring for adverse effects. Regularly monitor for signs of infection, liver dysfunction, and hematological abnormalities. Baseline and periodic blood tests, CBC, LFTs, are essential. Monitor for signs of infusion reactions or hypersensitivity, especially when initiating treatment. 6. Drug interactions. Be mindful of potential interactions with other immunosuppressive agents as well as with medications metabolized by the liver, e.g., methotrexate. 7. Pregnancy and lactation. Some BDMARDs are contraindicated or should be used with caution during pregnancy and breastfeeding. Planning pregnancy should involve a detailed discussion of risks and benefits. 8. Patient education. Educate patients on the importance of adherence to monitoring protocols, recognizing signs of infection, and avoiding exposure to contagious illnesses. 9. Financial considerations. Consider the cost and patient access to BDMARDs, as these therapies can be expensive and require insurance coverage or financial assistance programs. Tailoring these precautions to each patient's individual risk factors and comorbidities is key to successful management. Regular follow-up and open communication with patients are essential to adjusting therapy as needed.